Last weekend, we were talking about the enormous strain on the NHS as a result of rising coronavirus cases. Now, that pressure has not gone away, but it does seem the rate of infections may be slowing. Well, let's talk to our first guest about that, Imperial College London Professor Azra Ghani. Thank you so much for being on the programme. The last thing I want to do is to underplay the deaths we're seeing, the hospitalisations we're seeing, the cases we're still seeing. But is there the beginning of a chink of light at the end of the tunnel starting to appear?
Yes, absolutely agree. We're in a very difficult situation at the moment, and the NHS is possibly at its worst that we've seen so far during this pandemic and indeed in recent history. So it is important to note that we have started to see a small decline in cases in some areas. So that is certainly positive news that the current restrictions that are in place are having the effect that we hoped. It's very important over the coming weeks that people adhere to these restrictions and we continue to see the cases decline. We expect to then start to see decreases in hospitalisations coming through in the next week or two.
Is it the current restrictions that we're starting to have an impact, the full national lockdown, or the older restrictions that we saw, the sort of tier 4, if you like?
Well, both will have had some effect in slowing the growth in cases. The most important thing that we're seeing now is actually a decline in case numbers. And that's what we really need to accelerate as far as possible, because this is, of course, saving people's lives and avoiding unnecessary illness for all of these individuals who have been infected. It's a very difficult disease to deal with.
There's been lots of talk, almost every news conference they're asked, when will the restrictions end, when will we get back to normal? So I'm interested to get your view on that. Will it be when a certain number of people are vaccinated, do you think, or when case numbers decline to a certain amount? And when roughly, I know it's very hard to say, but when roughly do you think that could be?
Well, it is a combination of exactly those two things. The first thing we need to focus on right now is getting those case numbers down. Really, we want to get back to the situation we were in the summer with relatively low case numbers compared to now, so that we can actually test and trace and reduce onward infections. At the same time, we're of course rolling out a vaccine. That's something we haven't had up until now, and that vaccine rollout is going very well. That will hopefully protect those that are most vulnerable to the severe consequences of this disease. But we'll need to get a balance of these two things in place before we can start to lift restrictions. And it's very difficult to say exactly when that will be.
Chris Whitty, the Chief Medical Officer, has said that COVID could become seasonal, a bit like flu. Do you think that we could see a situation where restrictions are, or some restrictions are reimposed around the winter months?
It's possible. I think we're very much hoping that the vaccine will enable us really to go back to as normal a life as possible. But we have to remember that the virus is still circulating globally. And even if the UK is fully vaccinated, it's likely that we will get importations continue. So that's why it's also incredibly important that we support wider efforts to ensure vaccination is available to all countries, not just those that are able to pay in this first phase.
And how much do you support the recent news we had that actually the border restrictions are being tightened up? Do you think that should have been done sooner?
Well, we know that the virus is circulating everywhere, and we also know that these mutations, these changes in the virus, are happening all the time. And so it's very difficult to predict where these new issues will arise. We've clearly had one of these so-called variants of concern in the UK. Others have emerged in South Africa and Brazil. But anticipating where those changes will happen is impossible to do. And so I think we'll have to take some pragmatic approaches. In the short term, closing borders obviously helps prevent more of those infections coming in to the UK. But as we get the vaccine rollout and continued surveillance and monitoring of the strains that are circulating, we will be able to, for example, tweak the vaccines to make sure that we remain protected.
Good news about, of course, the ability to hopefully tweak the vaccine. And I know how unpredictable the disease is, but at the same time, it was quite predictable, as you say, that the virus will mutate. I struggle to understand why the border restrictions weren't toughened up sooner. I mean, you don't even have to show that you've had a negative test until tomorrow.
Well, again, we've got the virus circulating here, so these mutations could, of course, happened in the UK and indeed have happened in the UK. So it is really a balance that has to be made. From an epidemiologist's point of view, we, of course, want to try and restrict importations as much as we want to try and reduce the levels of transmission occurring locally. But there are wider balances to be made in terms of the impact that this has on people's lives and livelihoods, and that is therefore a political decision.
The vaccine, of course, is a really good piece of news that we've had recently. It feels like the rollout is tentatively going quite well. I mean, the official target is to vaccinate all over 50s, shielders, people who work in the NHS and care homes by the end of April. From what you've seen, are you hopeful that it might actually happen sooner than that?
I think that remains a sensible target given the rollout so far. We obviously have exceeded the levels of around 2 million a week that we were initially aiming for, and therefore the hope is that most vulnerable will be protected in the near term. We have to remember that once we get towards springtime, we also have to give those second doses out. So essentially, the numbers will need to double to ensure that people become fully protected.
And if we do get to a situation where we have vaccinated the most vulnerable, vaccinated the people who are most likely to get sick, very sick, if they get COVID-19, is that a point when it's acceptable to start lifting restrictions and allowing the virus to circulate among younger people?
It will be a combination of having those people protected, but also, of course, trying to reduce transmission as much as we can in the interim, because there is a balance between these two things. And we have to remember that many of the people in hospital are indeed younger than even 50 years of age, and we do want to protect the whole population.
And then just finally, I want to ask you about the spacing between doses. The UK has obviously decided to space out the time that people can receive the first and second dose up to 12 weeks. Is there a risk that the virus may be more likely to mutate given the spacing?
The spacing is based on data, certainly for the Oxford AstraZeneca vaccine, and in that they showed that the efficacy did remain high between initial dose and right out to 12 weeks. And if that high efficacy remains in place, then we don't have any concern about specific mutations occurring to the virus in that period. The Pfizer vaccine, we don't have as much data, but it did show very strong efficacy from 12 days following the first dose right through to the second dose being given at 21 days. And so the other measurements that we have on that vaccine and the wider understanding is that it's likely that there would remain very high efficacy. And as if the vaccine is highly efficacious, then that reduces the risk of these mutations occurring. It doesn't ever exclude them, and we may, of course, need to adapt vaccines going forwards.